Hi everyone, it's Burr from Nutribell with Burr, and this is our second video on this series, our fortified foods making us sick. Today we're going to have a look at vitamin D, sunshine vitamin. It's really more of a hormone, exploring the impact of synthetic vitamin D and the risk of oversupplementation. So we're looking at the sunshine versus supplementing. So the functions are vitamin D, it helps build strong bones and maintains adequate calcium level in the blood. It supports bone repair and helps them stay healthy over time. It helps for healthy connective tissue like cartilage and collagen. It helps the kidney reabsorb calcium and phosphorus, promotes normal growth, and helps support the immune system. There are many other things that vitamin D is claimed to be a panacea for: chronic fatigue, fibromyalgia, cardiovascular, prevention of disease, Alzheimer's, Parkinson's, multiple sclerosis, and cancer. Those are to name a few, but those are highly debated in the literature, and it's not what the focus of this video is going to be on today. So natural vitamin D comes from sunlight, and we're going to talk about the metabolism of that in the next slide. But the importance of why the sunlight is very important, because it actually helps. It's a self-regulating process, so the body stops production once optimal levels are reached. So that's really key. There's no risk of overdosing of vitamin D when you get it through the sun. Also, it triggers other photoproducts like luminestrol, which can have benefits. So it prevents over-keratinizing of the skin. So where you get those thickened skinned areas in your toes or on the sides of your fingers, it can stop that from happening. It also can stop the overproliferation of melanoma cells. It can also help. It also produces antimicrobial polypeptides, which can fight bacteria and viruses. It can also help with our circadian clock, so that, you know, if you go out in the morning, you get the sunlight, you get that wake cycle with cortisol is released and melatonin is suppressed. And then it kind of goes down later from midday in the afternoon, it starts to decrease cortisol. And that's all thanks to going out in the sunlight. Another important function is that it helps produce nitric oxide, and that actually helps vessels to dilate, which helps lower blood pressure, and that can be cardioprotective. So there are two types of vitamin D. There's D3 and D2. D3 is called cholecalciferol. That's the kind we get from the sun. You can also get it in supplement form. And then D2 we find in fatty foods. You can also get D2 in supplement form. So fatty foods are liver, fatty fish like salmon, mackerels, sardines, eggs, milk, pork. Also in plant-based foods, mushrooms is the most predominant one. Also some seaweed. Cremini are supposed to be the best mushrooms for the highest source of vitamin D, as far as I could read. And then obviously we have the supplement form down here. That one is cod liver oil, but it has all the fat soluble vitamins. Okay, so this is the metabolism of vitamin D. So the sun rays hits the skin, and it interacts with the skin with a compound called 7-dehydrocholesterol. It's a bit of a mouthful, which is a precursor made in the liver from cholesterol. That interacts with the UVB rays, and it forms pre-vitamin D3. That's the inactive form. Then that travels into the blood. Then we have our food sources up here are vitamin D2 and vitamin D3 from supplement form. They go into the small intestine where absorption happens. And then these chylomicrons here are released once fatty foods enter the small intestine. They release chylomicrons, which are like little vessels which carry fat packaged with the fat soluble vitamins, and they are taken into the lymph system, and they travel around the lymph system. And then from there, it's released from the lymphatic system, from the thoracic duct, the biggest duct gland in the lymph system, and that drains it into the blood. Now, the vitamin D, when it's in the blood in the inactive form, it binds to the vitamin D binding protein. You can see that here, and that's taken all around the circulation. Then it travels into the liver, and in the liver it has to go through, there are two phases now that have to happen. So in the liver is the first phase. It's almost like if you think of making bread. So you have your flour, your water and salt is the first phase. And then we add an enzyme to that, CYP2R1, which then converts that flour, water and salt into 25-OHD3 through a process called hydroxylation. So it's a chemical reaction. So then it's still in an inactive form in the liver, and then from there it goes into the kidneys. And in the kidneys, we now add the yeast to the flour, water, and salt, so it now becomes active. And again, we involve some enzyme here called CYP27B1. And then the active form, it's called 1,25-dehydroxy vitamin D3, which is the active form. Now you need magnesium and zinc as cofactors for this hydroxylation. So then once it's active, it then acts on metabolic functions in the body. It increases the absorption of calcium and phosphorus from the small intestine. It promotes bone mineralization, so to help make strong bones. And it induces cell differentiation in the immune cells, supporting the immune system. Now, magnesium is a very important mineral, and if you have adequate levels of it through diet or supplementation in your body, it can prevent hypervitaminosis of vitamin D, so overdose or toxic levels of vitamin D if you were supplementing and you took too much. It also was associated with reduced risk of vitamin D deficiency and insufficiency, and there are some more functions of magnesium. So you need both of these, magnesium and zinc, as cofactors. So if your levels, you were supplementing with vitamin D or you're getting enough time in the sun, your levels were still low, you might also need to look at these cofactors to see if you had adequate levels in your diet. So now we move on to the calcium vitamin D parathyroid axis. So the parathyroid gland sits at the back of your thyroid gland. There are four little glands. You can see them 1, 2, 3, 4 here. This is the back of your thyroid gland. Thyroid gland sits here in your neck. It's a butterfly shape gland, which is responsible for regulating metabolism through the release of thyroid hormone. So the parathyroid gland senses low serum calcium, so low blood calcium. So then the parathyroid gland releases parathyroid hormone. Then that acts in a few different ways. So it then stimulates the bone to release calcium and phosphorus to raise the level of calcium in the blood. It also stimulates the kidneys to release calcitrol, the active form in the kidneys, to increase that formation of that. And it decreases the excretion of calcium from the urine, so it holds on to the calcium, so it's not excreting the urine, all in an effort to elevate the serum calcium. So then the small intestine, it also acts on that to increase the absorption of dietary calcium. So now we have all of these things in place. We're releasing calcium from the bone, we're releasing calcitrol from the kidneys, and now we're also increasing the release of calcium from the small intestine. All now have elevated the level of serum calcium. So the blood calcium now is up, and then this feedback loop can now send a message, and it can actually reduce or switch off. So it keeps a tight regulator. So it's like a thermostat. So it flips on and off when it's required. So you can also test parathyroid hormone. If those levels are elevated, then that might be suggestive that you're vitamin D deficient. Vitamin K2, I'm not going to say too much, only that's synergistic with vitamin D, and it helps move the calcium out of the blood and away from the soft tissues and organs like the heart and the arteries, preventing calcification of the arteries, into the bone to create nice, strong, healthy bones. So I hope that was pretty easy for you to understand. Now, vitamin D deficiency, what is it? So it's weak bones. Well, what does it cause? It causes weak bones, rickets in children, and soft bones in adults called osteomalacia. It also contributes to osteoporosis, brittle, thinning bones, muscle weakness, increased risk of fragility fractures. And again, we said deficiencies were linked to things like chronic fatigue syndrome, fibromyalgia, cancer, depression, cardiovascular disease, autoimmune disease, but these are all highly debated. Chicken or the egg? Is the chronic fatigue syndrome triggered because the person can't get outdoors, spend time in the sun, and is that why their vitamin D levels are low? And then if we do supplement with vitamin D and get to optimal levels, do we see the chronic fatigue chronic fatigue syndrome disappear? In most cases, no. So it's not the panacea that it's made out to be, is my point here. And we need to really see the wood from the trees. And there's always the, chicken or the egg, which comes first? Is it the fact that people are not able to get out and exercise and, enjoy nature and get sunshine, that's contributing to the vitamin D deficiency and causing and one of the factors that's causing the chronic fatigue, but there are many other factors involved. So in the early 20th century, rickets was found in Northern European countries, which was characterized by impaired mineralization of bone matrix. It presented with hypercalcemia, so low calcium, hypo, and then that caused alopecia. It also caused joint disformity, so rickets, and it also presented with, can also present with a rash called ectodermal pigmentosus. And luckily, we don't see as much of that nowadays as foods are fortified, and we're way more into testing and monitoring people, and especially our vulnerable groups. So now we move on to vulnerable groups. So lifestyle and environmental factors. So if you have limited sun exposure, you cover up due to religious reasons or for whatever reasons, fear of the sun, clothing, indoor jobs, night workers, high-rise buildings. Then we move on to the medical factors and physiological factors. We have the aging population who live in nursing homes, who get less time outdoors, who are less mobile. And as we age, we have reduced skin synthesis of vitamin D. Compared to when we were younger. Also, we have reduced absorption rate of vitamin D from supplements and from food. And then these people are at a higher risk of falls and fractures. Darker skin types have lower vitamin D synthesis, so they need longer exposure to sun or maybe supplementing all year round. Obesity, vitamin D is sequestered in the fat. So what actually that means is the vitamin, so if you're obese, you have a lot of extra adipose fat, so under the skin and probably visceral. And then this fat holds on to the vitamin D and it's not seen in the serum. And partly the reason that it's thought that this happens is because in obesity, if you're inactive, that fat is dysfunctional. So if you increase your activity, even if you're obese, that would help release the vitamin D from the fat, and you'd have a more metabolically active fat. So there is another reason to get out moving. You get outdoors, get moving, get some sunshine. Even if you have extra fat, you'll actually make that fat more functional and more metabolically friendly, so then that you can get mobilizing that vitamin D. Then we have GI disorders, irritable bowel disease, chronic Crohn's, celiac, bariatric surgery, all promote poor absorption. Liver, kidney, parathyroid disease, it could be a cancer, it could be cirrhosis, whatever, impair the conversion to active form. Breastfed infants, because it's low in breast milk and formulas are already fortified. You can have genetic variation in the vitamin D receptor site, so that can affect how you convert. And then multiple sclerosis. So it's been seen, it's been thought that the incidence of multiple sclerosis increases the further you move away from the equator. It's not known if that's just vitamin D alone or if there are other factors, but also the research pointed to that multiple sclerosis relapses are much higher in people with lower levels of vitamin D. Then we have dietary factors, so vegan plant-based diets, even though many of the foods are many of those foods now are fortified. Low-fat, no-fat diets impair absorption, so you are not able to absorb the vitamin D if you're taking it through a supplement. And if you eliminate dairy, you eliminate a natural source of vitamin D. High-fiber diets are another thing that are not on this list. They're on the next slide. They bind up vitamin D and pull it out. So if you're taking a supplement, take it away from high-fiber, things like psyllium or flax. So you don't want to get it lost in the fiber. Certain drugs, anticonvulsant steroids, weight loss meds such as the Wegovy, Ozempic, the GLP-1 antagonists, they all impair the absorption of vitamin D, and all of these groups need to be monitored and need to have a baseline blood test done to see what their levels are, and to be then to be supplemented accurately, and the dose is titrated up and down according to their results. So always test before supplementing, and if you're supplementing and you retest, you need to have a 4 to 6 week washout period before you test again to get a true representation of what actually is going on in your body. Also, it's important to remember that that the blood test itself can be quite fragile. So if exposed to too warm a temperature, or in the transport too long, or mishandled and not stored properly, you can get inaccurate readings, or so you can get a really high reading or really low reading. So if you get either of those, you need to actually have the test repeated. Competing nutrients, most of these I've already mentioned above. Competing nutrients of vitamin E and K use the same absorption pathways. So if you were supplementing with, if you were deficient in vitamin D, you'd probably start just with the vitamin D3 supplement and leave K out initially because you don't want to compete in that pathway. So you also, if you were taking vitamin E and K, you might want to take them away from when you're taking your vitamin D. So in the later part of the day. Excess vitamin A antagonizes vitamin D absorption. They actually bind to the same cell receptor sites, so they kind of compete for it. So again, if you were having lots of vitamin A supplementation and cereals with vitamin A in, you would probably want to again think about when you're taking your supplement. It's almost like you plug into your socket several devices to recharge, and it overheats, and nothing really gets recharged because it's ready to go up on fire. So there's a competing for the actual receptor sites. We've already talked about all the others, so I'm going to move on. So the NIH recommends the daily allowance for vitamin D for 0 to 12 months to be 400. So I'm not going to go through all of these. So it's between 400 IUs and 800 IUs. And then for adults in between is 600 IUs. And for pregnancy is 600 IUs. So the important thing here is to remember the 1 microgram, because it's sold in micrograms and IUs. So 1 microgram of vitamin D is the same as 40 IUs. And 10 micrograms of vitamin D is equal to 400 IUs. And this is where people get confused, because they get prescribed something and they go off and they get the wrong dose, and they get maybe 2 or 3 times a much higher dose, and then they get into toxic levels. So that's very important. So then if we're looking at serum levels of vitamin D for health, so serum 25-hydroxy vitamin D concentration in the blood, if it's less than 30, so less than 30, it's considered to be deficient and could lead to rickets in infants and children, or osteomalacia in adults. Then 30 to less than 50, generally considered inadequate for bone. So you want to be above 50. So 50, 60, 70 are good range to be generally considered adequate for bone and overall health. Then greater than 125, there's no benefit. And if we're going up to 150 range, then we go getting into the toxic levels. So we want to avoid that. And some supplements that were tested independently, they found that the dose stated on the package was much higher when tested independently by different labs. So people were getting toxic levels of vitamin D. This is the problem when you're buying off Amazon. There are many products now sold with 4,000 IU, which is way above the recommended daily dose. So if your baby is being breastfed exclusively, the NHS guidance is for 8.5 to 10 micrograms of vitamin D daily to support bone health. Some research from Sweden in 2004, they saw in the second half of infancy that vitamin D supplementation may interfere with normal immune development, increasing the risk of seasonal allergies. So that's something to consider. Now, too much of a good thing. Toxicity is primarily driven by hypercalcemia. So we're seeing hypocalcemia when we haven't got enough vitamin D in the body, so the calcium level is low. And then that's where we're prone to the problems with the bones and when we're hypercalcemia, then we get deposits of calcium in the kidneys and in the organs. So it can affect the brain area through drowsiness, psychosis, stupor, coma, the GI system with abdominal pain, weight loss, constipation, pancreatitis, peptic ulcers, the cardiovascular system causing high blood pressure, abnormal heart readings, and heart rhythms like bradycardia. Then in the kidneys, it causes excessive urination, thirst, dehydration, hypercalciuria, and kidney damage and renal failure. So here you can see the kidney stones. Other symptoms can be joint pain, calcium in the eye, it's called keratopathy, and hearing loss. So I just want to fly through those. So now these are some case studies. Vitamin D toxicity in children. There were 38 children aged 0.3 to 4 diagnosed with vitamin D intoxication. They presented with vomiting, loss of appetite, constipation. The serum calcium level was raised and the vitamin D level was raised to toxic levels, 396. 15% presented with calcium deposits in the kidney. So again, to be very important to check dosing of your supplements, what you're actually supposed to be giving, and to cross-check that you have your units correct. The NHS England 2023, they stated that a coroner raised concern after a patient died from intestinal bleeding linked to vitamin D induced hypercalcemia. The cause of death was high blood calcium caused by excessive vitamin D. The National Reporting and Learning System flagged 42 incidents over 2 years involving high-strength vitamin D prescribed more frequently than intended, and some patients requiring hospital treatment after hypercalcemia. Now, this high-strength vitamin D prescribed more frequently than intended could have happened because a nutritionist or a doctor had seen the patient, and then the patient didn't bother, or they either, both culpable, didn't follow up with a follow-up appointment to retest the blood levels to see how that patient was responding, and so the person stayed on the high dose maybe for several years, and that could have caused toxicity. Also, we talked about supplements and not having the accurate dosing, buying them from Amazon. This case was pretty well world renowned. A British man who had watched a nutritionist on a British daily show who was promoting vitamin D supplements as a panacea for all, and he contacted her after the show. And after seeing the nutritionist from the show, he began taking 50,000 IU 3 times a day. So he was taking 375 times the recommended dose. He also consumed 20 other supplements. So there's a real red flag. If somebody's consuming that many supplements, then there's really something going on that needs to be looked at. We shouldn't need to be taking that many supplements. And maybe many of these supplements overlapped with several vitamins, including the fat-soluble ones like A, D, E, and K, which is quite dangerous because we can't get rid of them in our urine. So if you're doing due diligence, the nutritionist or the doctor would check what other supplements you're on and ask you to bring them in so they could see them. And if you're just taking 20 supplements to harm yourself every day, I would say that's a waste of money. Stop taking them and really, really look at what's in these supplements. Nausea, vomiting, diarrhea, abdominal pain, leg cramps, and tinnitus were his symptoms after 1 month. And he was referred to hospital after 2 months, and he had lost 28 pounds in weight. He had prevented with hypervitaminosis D, and kidney damage was detected. So you can see how easily this happens. These are a few more case studies. A 14-month-old breastfed infant was given 3 times stronger than the label, 3 times stronger than the label, vomiting, lethargy, and dehydration. And sometimes for little babies, this comes in drops, so it can be actually difficult to guesstimate the right amount. 7 children between the ages half a year to 4.2 years consumed fish oil mislabeled with 4,000 times the vitamin D. They had severe hypercalcemia. A 56-year-old woman took 130,000 IUs daily for 20 months for her multiple sclerosis. She ended up with kidney injury and vitamin D levels, which were at toxic levels. It took her 6 to 18 months to recover. Then there were these 2 teenage boys who both, within 2 weeks of each other, denied taking any vitamin D supplement, but it was found that there were 425,000 IU servings in their creatinine supplement. It ended up in kidney injury and severe hypercalcemia. Remember, we're saying the NHS guidance for vitamin D supplementation is 400 IU, which may be too low from a functional perspective, but that's what the NHS guidelines is, 400 IU. So this was 425,000 IU. Anyway, so the narrative is to test, not guess. And again, you go to your GP and they can test for you. This is the Vital Study, the final word on supplementation. So they did a random controlled trial on 25,871 participants. They looked at 2,000 IU of vitamin D3. They also looked at omega-3 fats, but that's not our talk today. And this was a very large study. Men were averaging the age of 50 and women 55. The significant findings were no significant reduction in major cardiovascular events, any of those listed. No significant reduction in invasive cancer incidence. Possible benefits in reducing cancer mortality. In post hoc analysis, African Americans, 23 suggested a reduction in cancer risk. Fracture prevention only when deficient present. So that's important. The fracture prevention was only prevented when deficiency was present. Then on this post ad hoc analysis, they actually did say it needs to be followed up by further research to clarify. So this was 2,000 IU per day, which is well over the 400 or the 600 recommended for this age group by the NIH. Didn't show any extra protective benefits. So it is not a panacea. Don't just go overdosing, and also look at all your products to see what has vitamin D in. More is always better. So there's so many health foods now, and it was impossible for me to go all through them, but I did find this one, Moji Immunity Shot, which is sold everywhere. It's sold in supermarkets. And it's an immunity shot, and 100 ml serving of that gives you over 220% of your recommended daily amount in one serving. Now, it does give you over 333% of your vitamin C, but at least with vitamin C, you can weed that out. But with the vitamin D, because it's fat soluble, it gets stored and starts to build up and become toxic. And then these people may then continue to take their multivitamin. They may even take a vitamin D supplement, and they may even take a cod liver oil tablet as well. So, and then they have cereals and fortified milks, all of these which are fortified with vitamin D. So then you can see how it accumulates to toxic levels. So the key takeaways from all of this is sunshine is your safest, and also be safe in the sun. Synthetic vitamin D is helpful, but needs to be personalized. So you need to work with a doctor or a nutritionist or dietitian. Supplementation may help certain groups, but indiscriminate use offers no proven benefits, as we saw in that very big Vital study. Mega dosing based on wellness trends can lead to toxicity and long-term complications. Best approach is to test levels, target supplements, optimize sun exposure when possible. Now, you may need to take vitamin D throughout the winter, and also depending on what kind of a summer you've had. But I would say test and find out what your levels are at, and always always have vitamin D with fat in your diet. I think those are the main points of today's talk. I hope you found this helpful. Thank you for watching. Please like, subscribe, and support me. That's great for me to keep me motivated to keep doing these videos. Thank you for watching. If you want to get in touch with me or work with me, you can contact me on belwithbur@gmail.com or WhatsApp me on this number. You could have a free 15-minute discovery call where I can chat with you, and then you can see if I'm the right person to train you with kettlebells or to do a nutrition consultation. Thanks a lot, and goodbye for now.